Hello, I'm Joseph Lovatt-Fraser, a PhD student in the Department of Surgical and Interventional Engineering at King's College London. Today I'll present a series of work carried out within the Robotics Vision in Medicine lab at King's, demonstrating optic nerve sheath fenestration with a multi-arm continuum robot, and then describe our most recent development of a Bioinspired suction cup equipped needle for minimally invasive optic nerve sheath fenestration. So here we're talking about papilledema, which refers to swelling of the optic nerve due to intracranial pressure buildup and can be an indication of serious conditions such as tumors and CNS inflammation. Results commonly in blurred vision, but can also cause complete loss of vision if untreated. To highlight its impact from 2002 to 2016, the incidence of IIH, which is a similar brain high pressure disorder, rose by 108%, with hospital visits increasing by over fourfold. Furthermore, there's a projected cost of almost 500 million by 2030. So that's just some background. The solution to this is through a surgical procedure called optic nerve sheath fenestration, which is reserved for patients with significant papilledema when drugs don't work. The procedure aims to open the optic nerve sheath locally and provide a drop in intracranial pressure by releasing cerebrospinal fluid from the nerve. However, access to the optic nerve requires detachment and manipulation of the muscle, as well as fat removal, all to expose the optic nerve and perform a millimeter scale incision on the nerve sheath. So you can imagine this is a very challenging and invasive procedure carrying high risk, especially that of reoperation with complication rates as high as 45%. So surgical robots offer solutions to the unique challenges in deep orbital interventions such as these. Our work builds upon a previously proposed concentric tube robot to access the optic nerve from around the eye, which is the first piece of work to actually robotize optic nerve sheath fenestration. It incorporates 3 arms. You have a needle and gripper arm to perform the intervention collaboratively by gripping and making an incision in the sheath, and a camera to visualize this. So we can reduce the number of arms by combining the gripping and incision functionalities into one. And we propose this as Grip Needle, which is a miniature suction cup gripper attached to the needle arm of the CTR, shown on the right. So as a result, a smaller number of continuum arms are needed to perform the same optic nerve sheath fenestration task, and additional CTR arms with alternative tools can be used, such as surgical blades, which greatly increases the setup capabilities. There's a lack of comparative data on the requirements of optic nerve sheath fenestration in literature, particularly the force required to pierce the optic nerve sheath. So to determine this, force deformation trials were run on porcine eyes, with the sheath piercing requirement concluded at 0.1 newtons, which is characterized by the first force jump. And then moving through insertion into the sheath, we characterize the maximum force as to not pierce the nerve itself at just under 0.2 newtons. So our suction cup gripper design is loosely inspired by octopus suckers that have malleable and contractile components to provide sealing and induce pressure gradients, with the additional function of grooves that increase the surface area for sticking. So applying this to our miniature cup, we create a cup that's composed out of a sticky gel and a hollow plastic cup, which is attached to curved tubing to fit around the eye curvature and host interventional tools. A simple analytical study was performed to determine the cup dimensions to perform 0.1 newtons of force for fenestration, and that is a 3mm outer and 2mm inner diameter cup with a 1mm thick gel. And this gel provides lateral gripping force, which was a main disadvantage of current suction cup gripper designs. So for the modeling, we started doing a simple finite element model with analysis into the complex gel deformation in different loading instances, surface conditions, and gel geometries. So we created an axisymmetric cup finite element model from the cup cross section, and then applied it to different stages of grip. So first you see the push sealing stage, initiating the pull on the surface, and then near grip loss with the target surface. And this was done with dry and wet conditions, with different target material stiffnesses and different suctions induced. And this overall gave us a better understanding of cup behavior in later experiments, as well as influencing the design of a sticky gel in a future study. The main conclusion here was that the gel needed to be 10 times softer than the target for successful grip without detachment, and the addition of a gel parametric study allowed us to look into the half height and half thickness parameters of the gel, again useful in future studies. The next step was to assess the optic nerve site access with the miniature cup, and this was done with a realistic eye phantom which was placed in a skull phantom, and then a miniature cup could then bypass the eye through the small entry point as well as reach the optic nerve without any damage, and both of these conclude as less invasive than current optic nerve sheath fenestration. So we have success. Moving on to ex vivo tests, specifically optic nerve gripping. The miniature cup gripping success was determined by gripping and suspending porcine eyes on fat, nerve, and muscle locations. So the reported mass values on the left represent the weight of a porcine sample grip for more than 5 seconds. All target locations provided, on average, successful grip over the required 0.1 newtons. So we have success there. Specifically, the highest success on nerve, around 70%. However, the main fallback here was that incision was not possible whilst maintaining the grip. So this leads to the first avenue improvement, which was to look at the cup design itself. So we propose an alternative cup design, which was a 45-degree angled cup, fabricated with gel and foam, essentially having a curved profile that improves gripper performance by complying with the optic nerve, and also the fact that the needle is inclined with respect to the nerve allows it to slide under the sheath, reducing the chance of penetration to the inner nerve layer. We also added a medical wire junction to this prototype, which allowed more robust testing of simultaneous incision with airtight suction, so retracting and then feeding the needle. We quantified normal and shear load capabilities by measuring gripping force across 4mm diameter samples of stainless steel, nitrile rubber, and silicon tubing for both gel and foam combinations. So first focusing on the 45-degree angled cup, looking at the foam cup in the wet scenario, which is more realistic, it achieved higher gripping force than all other material cups. And if we directly compare it to the previous 90-degree cup, more specifically looking at the nitrile rubber in wet scenario, can see a 6-fold increase in the normal force achieved. A drastic change just by angling the cup and adding a foam interface. So then moving on to ex vivo experiments, we were able to quantify further the new cup performance by assessing grip success on porcine eyes. So a successful grip and incision of the porcine optic nerve sample could only be achieved using the gel foam interfaces, not gel by itself, with half of the trials performing incision regardless of the grip. The first observation here is that we're able to see incision whilst maintaining the grip. Despite being only at 20%, the fact that we can achieve this with a cup prototype made relatively inconsistently is pretty impressive. So this nicely moves us on to developing future work, which first focus on making the cup have a higher success rate. This initially involves improving gel properties through additional finite element studies, as well as reducing fabrication variability through additive manufacturing and 3D printing of a flexible cup. And this can also lead into considerations of material biocompatibility. What can also be done is do ex vivo tests under OCT, which can indicate better success of a needle incision compared to the previous porcine samples, and can also lead to performing injections during the grip. Finally, moving on to further applications for drug delivery in minimally invasive surgery, we can essentially robotize the setup by combining with the concentric tube robot to apply controlled suction and be more precise, as well as sensorization of the whole system to observe the gripping and contact forces that may be required for other interventions. Thank you for listening.